Thanks, Vasante. We're doing very well on time. We're right on time, actually a few minutes ahead, but I think we'll begin because the panel is here for the Empower Rapid Fire session, part one. You'll hear part two this afternoon. The next session is a series of short rapid fire presentations from the research teams who received and completed OSSU Empower projects. I just wanted to take a moment and let you know that we have, OSSU has recently launched the 6th Empower project call for proposals, and the information is available on our website. Again, that's OSSU.ca. And now I'm pleased to introduce the moderator for this session, Ms. Maureen Smith, who you heard in the last session, who is currently the chair of OSSU's Patient Partner Working Group, and she's also a member of the board of directors. Maureen is also chair of the Cochrane International Consumer Network Executive and a commissioner of the Global Commission on the Use of Evidence to Address Societal Changes. Suffice it to say that Maureen has made incredibly significant contributions towards health and health services research. Maureen, over to you.
Thanks, Dean, for that nice introduction. So good morning, everyone, and welcome to OSSU's Research Day, Engaging Multi-Stakeholders for Patient-Oriented Research, Wider Effects and Reach project known as Empower, lightning round session. Now everyone knows what Empower stands for. So the purpose of the Empower project is to provide end of grant funding to a co-designed project that is in need of an infusion of money for further dissemination, awareness, and implementation of an original project goal to move that project forward. Projects are selected by a committee of scientific reviewers and a committee of patient partner reviewers. The Patient Partner Review Committee provides the final shortlist and makes recommendations to OSSU. In this morning's session, which is one of two, the other being in the afternoon, we'll have the pleasure of hearing from 9 teams present highlights from the outputs of their projects focused on their policy brief. So I'm pleased to welcome our lightning round speakers to the virtual podium. And our first speaker is Peter Gill from the Hospital for Sick Children. He'll be speaking about the top 10 patient-oriented priorities in pediatric hospital care in Canada. Over to you, Peter.
Hi, everyone. Thanks, Maureen, for the kind introduction. Thanks for the opportunity to speak here. So as Maureen mentioned, going to be talking about taking forward the top 10 priorities. We had conducted a priority setting partnership where we identified the most important unanswered research questions in pediatric hospital care, which reflects about 1/4 of all admissions to hospital for children. So first, what we did is we had an active social media campaign where we worked on publishing several tweets highlighting the top 10 questions, and led to over 16,000 profile visits on our site and just over 100,000 impressions. Next, we developed a research report, which was a detailed overview of a priority setting partnership that overviewed the steps that we conducted, the purpose of it, and for each of the individual questions, it outlines a key research strategy and some of the specific questions to move forward. And this research report document will form as sort of an executive summary to help outline next steps for the project. Next, we hosted a virtual roundtable with 10 parent and caregiver partners that was actually chaired by 2 parent partners. And that was to help us contextualize the top 10 questions to better understand how we can come up with important nuances to help influence policymakers to actually fund these specific priority areas. And the input from that policy brief, from the virtual roundtable, is now used to begin to develop our policy briefs, which are nearly finalized, with excellent input from John Lavis's workshop, that are going to be used to target funders, particularly CIHR and other funding agencies, about how they can dedicate specific funding to address these important unanswered questions, and really outlining more specific areas where funding could actually make a significant impact, particularly influencing from the parent and caregiver perspective. And then the final output of an ongoing process that we're working on is we are building partnerships with Indigenous communities in terms of how we as a research network can work with Indigenous communities to help to address some of the important unanswered questions. And we have been establishing relationships with various of our network individuals across Canada, working with local contacts and really working on outreach and what we can offer to these communities. So overall, it's been a really busy but very impactful and engaging last 6 months, and with much work moving forward. But we're very grateful for the opportunity to have this ENDA grant funding and look forward to carrying this forward with further impacts. Thank you very much.
Thank you so much, Peter. And now we'll hear from Ivana Ristevski, a parent partner who is presenting on engaging patient partners and solving the top 10 priorities for eye cancer research in Canada.
Thank you, Maureen. So the Canadian Retinoblastoma Research Advisory Board, or CRAB, serves to facilitate involvement of patients in all aspects of retinoblastoma research. One of the first initiatives of CRAB was to jointly determine the top 10 retinoblastoma research priorities in Canada. The aim of this project was to increase awareness of and inspire action towards solving the top 10 priorities. The methods included a workshop consisting of 3 breakout rooms that focused on distinct dissemination methods, where they developed plans and materials. Each room was co-facilitated by a patient and non-patient partner and had 8 to 9 participants, with approximately a 1-to-1 patient to non-patient ratio. In figure 1 on the top right of the corner, the first image is the creation of the infographic and educational pamphlet breakout room, where working group members were sitting along tables, looking at a screen and discussing a topic. The next picture beside is the creation of video testimonials, where one of the members is sitting down being recorded for their video testimonial. The development of social media campaign would be a similar image to the first one, where people were sitting in a working room discussing and planning. The following dissemination outputs were created in the workshop, and they can be seen in the figure 2. First was the educational pamphlet with an infographic of the top 10 priorities. That's the first image with the blue eyeball shape. This infographic was designed by 2 patient partners with graphic design experience, and the breakout room members summarized the priorities to 4 categories. Next, we had 11 videos summarized the top 10 priorities, 1 for each priority and 1 overall. And there was 20 social media posts, which were 2 for each of the top 10 priorities, images and themes, and the order of the social media posts were decided at the breakout room, and volunteers helped finalize the posts. The outputs were shared at an international conference through CRAB outlets and targeted emails to key researchers. After the workshop, a policy brief was created targeted to funders of pediatric cancer research to align their call for proposals with patient-informed research priorities. The outcome was that these activities generated interest among researchers and health professionals who were inspired to conduct patient-partnered research to solve the top 10 priorities, and our Canada-wide retinoblastoma research community continues to grow.
Thank you so much, Ivana. So Ivana is here for a double header. She is now going to present on the development of a patient co-designed guide for partners in the project, the RB research booklet, and involving patients in retinoblastoma research. Back to you, Ivana.
Thank you again. So CRAB aims to identify and include a large and diverse group of patients in retinoblastoma research. This became particularly difficult during the COVID-19 pandemic, and new recruitment methods were needed. The aim of this project was to improve patient recruitment and involvement in CRAB through the co-development of a novel recruitment and educational tool, the Retinoblastoma Research in New booklet, and a distribution plan aiming to reach a diverse group of retinoblastoma patients. The methods are broken down to the development of the booklet and the development of the distribution plan. The CRAB working group members created draft content and image ideas at regular online meetings. Then I worked with a hired graphic designer to create designs and page layouts using the draft content, which was then shared with CRAB working group members. You can see this process in the top right of the corner. which was then worked on during the 2 virtual workshops to finalize the design and the content through human-centered design methodology. First, the first image, I'm sorry it's a little bit blurry to see, but we started off with the draft content, which was discussed at our meeting. The graphic designer then worked in real time to edit the image and take notes on edits to be made offline as well. I reviewed, then the second image is the draft that came back to me from the graphic designer. You can't really see, but there's yellow dots on it, which was my comments that I added notes about things that were discussed at the virtual meeting that weren't quite captured in the draft. So we worked together until all the comments were captured, and then the graphic designer finalized the page, ensuring that all the ideas and comments were there. And that's that last image. I have the actual booklet so you could see what it actually looks like. For the distribution plan, CRAB members discussed how patients typically access retinoblastoma information and research. I collected ideas into a unified list, which was then reviewed at our meetings and then prioritized by consensus at the workshop. The result was a 19-page booklet. You can see the image of it on the bottom right. It outlines how individuals' patients' lived experiences and skills can influence retinoblastoma research. Also, we have an accessible version on our website, www.rbcanadaresearch.com. And you can see the booklet here. Inside, some of the interesting things about it is there's benefits to partnering in research. And we also have patient stories, which talk about how patients have partnered in research, sharing their stories here. Thank you very much.
Thank you so much, Ivana. The next team is Kyla Naylor, a staff scientist at ICES, and Susan McKenzie, a patient partner. They'll be presenting on the Transplant Ambassador Program, a peer-to-peer program of kidney patients and living donors to guide others through the kidney transplant journey.
Thank you. There are multiple barriers that prevent us from accessing a transplant, even though it's the best treatment option. There are a shortage of kidneys available for transplant. Many patients lack knowledge about transplant and living kidney donation, and the process of being evaluated for a transplant is quite complex, requiring patients to endure more than 20 medical tests. And healthcare professionals often lack the time to help patients pursue transplantation as an option. Kidney transplantation is the best treatment option for many patients with kidney failure, offering patients a longer life with improved productivity and a better quality of life, and at a fraction of the cost of the alternative treatment of dialysis. So in 2016, there was a patient-led workshop that wanted to identify barriers and solutions to improve access to kidney transplant. And one of the key solutions that was identified by our patient partners was to provide support for patients with kidney failure from kidney transplant recipients and living donors. So a collaboration was formed between patients and researchers to develop the Transplant Ambassador Program, a patient-led, volunteer-driven support program, also known as TAP. So the overall goal of TAP is to ensure that all patients living with kidney disease and their families are knowledgeable about and have equal access to kidney transplantation and living kidney donation through supporting patients and families and learning more about transplant options and mentoring through them through the complex transplant evaluation process. So although we do not yet know the impact of TAP on transplant, the results of the larger trial that TAP was a part of are expected in 2023. We know that patients, healthcare workers, and ambassadors have commented on the positive impact of TAP. A process evaluation is also underway to give us more insight into the impact of TAP, and I'll leave it to Sue, our patient partner, to present the rest.
Thanks, Kyla. So as Kyla said, that the research continues, but we do have a lot of patient testimonials that confirm the benefits of talking with either a patient or a potential living donor. And we some of the best evidence of that is that many of the patients that we've spoken to over the last 4 years have become ambassadors after their transplant as well. So we have quite a few coming forward. You can see the numbers, 150 transplant ambassadors across 27 centers, over 5,000 interactions over the last 5 years, a very well-established webinar series with 50 to 70 people coming across the province. And we have 20 languages represented as well. So with the support of OSSU, we were able to mount our virtual program, which included an ambassador directory where people could view the ambassadors themselves, all 150 of them with videos, and a number of other options. Next steps, we hope to scale in scope, including a pilot in Nova Scotia. Here we go, done.
Thank you, Kyla and Susan. And now we welcome Kednapa, Thavron, from the Ottawa Hospital Research Institute, presenting on enhancing patient engagement in economic evaluation of healthcare inter.
Thank you for your kind introduction, Maureen. For some reason, I am not sure it's my or her connection. Today, I'm going to talk about the project entitled Enhancing Patient Engagement in Economic Evaluation of Healthcare Intervention. As some of you may know, economic evaluation is a systematic framework that looking at costs and consequences of at least two healthcare interventions simultaneously with the goal of optimizing healthcare allocation given limited budget. Traditionally, this type of research has been conducted as part of the health technology assessment, in which is looking at the impact of new health technology on social economics and also organization to ensure that the new intervention is safe, effective, offer good value for money, affordable, and at the same time address the need of the population. Our team's actually looking at the step of economic evaluation, as you can see from the middle of the slide here. Many of you may have not been involved in economic evaluation, but it may look familiar to you that the step of economic evaluation are very similar to other type of research. It starts with designing a research question, decision problem, and at the same time design study, analytical plan, data collection, data analysis, and presenting the result. Given the similarity, our team just questioning whether or not we should actually engage patient, and the fact that our previous research has shown that patient has extremely interest in engaging with this type of research. Our team working with our partner arranged 6 meetings, 1 meeting with OSSU partner, and we learned that the level of support for conducting economic evaluation are vary across the OSSU center. At the same time, we learned that there's no formal level of support in terms of engaging patient in economic evaluation. Working with our partner from diverse background, we arranged 5 meetings and with 5 patient partners. We learned that to ensure we can engage patient in economic evaluation, to ensure that economic evaluation question is relevant and meaningful for patient and caregiver, we need to ensure that they understand why they need to get involved and what would be the impact of their involvement. At the same time, we need to be clear in terms of what would be the level of expectation in terms of time commitments, compensation. They also need a certain level of empowerment and level of encouragement as well. And in order to ensure that they meaningfully engage in each of the steps of economic evaluation, a certain level of training is also required. In terms of the next step, we will arrange another meeting with our patient partner to refine our recommendation and framework, to develop recommendation and framework to ensure that when and where and how we should meaningfully engage patient in this type of economic evaluation. Thank you.
Thank you, Kednapa. Next is Lisa Duffett from the Ottawa Hospital Research Institute, speaking about the project Empowering Patient Ambassadors to Champion Research Outcomes and Priorities for People with Lived Experience with Venous Thromboembolism.
Thank you. I'll begin by just talking briefly about what is VTE core outcome set. So our base project was the creation of a venous thromboembolism core outcome set. This is a standard set of core outcomes that all key stakeholders agree by consensus should be measured in research studies for the treatment of venous thromboembolism. If you could just advance the slide to the next one, please. Thank you. The project includes a detailed literature review to capture the outcomes of previously used clinical trials, conduct qualitative interviews of key stakeholders, and that includes patients internationally to find a consensus on a final ultimate core outcome set for research. So our Empower Award was towards the knowledge translation of this project. Patients were collaborators and leaders in the co-design, operations, and analysis of the core outcome set project, as well as an important stakeholder group for determining the core outcome set. Carol West, a patient partner and a co-lead of our patient partner group, was the co-principal investigator of our project, and Suzanne Dubois, also a patient partner, joined us on the leadership team. So our project had several objectives, but the one that I'd like to highlight is an Empower workshop we hosted to discuss using patient stories in the communication and knowledge translation of our core outcome set. The workshop was created by our 2 patient partner leads and attended by our entire patient partner council. A communication toolbox was created by the patients and included visual, written, oral, and social media ways of using storytelling in knowledge translation. We discussed the various audiences and built outlines for adapted strategies for each. For example, incorporating storytellings in a policy brief for a research funding agency will be different than working with clinical trial steering groups or communicating to the general public. The patients also developed key messages that they viewed were priorities and strategies of incorporating storytelling in the communication of their messages. So our ultimate objective was to empower our patient partner group to use the knowledge they learned and function as KT ambassadors for the core outcome set. Our patient partners are already integrated into research teams and our research network, and thus they're in an opportunistic position to promote the results of the project that they had led. As part of the research steering committees and policy meetings, they can now be the voice that explains and promotes the core outcome set, so it can be successfully integrated into future research. Thank you.
Thank you so much, Lisa. And now we'll hear from Kerry Kuluski from the Institute for Better Health and Ida McLaughlin, a caregiver partner, who are presenting on co-designing strategies to address alternate level of care challenges to build capacity across Ontario. Over to you.
Thank you so much, Maureen. And apologies, as Ida McLaughlin, she got called in for a work-related reason today, so she's unable to join, so she sends her regrets. But really excited to talk about a partnership between Patient and Family Council and myself and other researchers on alternate level of care. And alternate level of care might be a familiar concept to some, but not others. It's basically when someone has completed their hospital care, but they're now waiting to get transferred either back home to a long-term care facility or a rehab facility. And what happens, because there's so many capacity issues in the health system that we're well aware of, particularly right now, people get stuck in kind of a holding pattern where they're waiting to move to the next care setting, but they're basically stuck in a hospital bed because that service is not yet available, or they might not feel ready to leave the hospital, and family members may feel unready as well. And so it's been an ongoing issue in our healthcare system, and it really warranted a partnership between people who had that lived experience to help us understand how do we now unpack this problem and develop a strategy to address it, which is what we did. So we established a council. We, through various co-design sessions and world cafes where you get together and have discussions through rotating tables with providers, patients, and families, we landed on an intervention which includes a communication tool to support conversations between care teams, families, and patients to kind of unpack what does ALC mean, what's going to happen, what are the priorities. And we also co-designed a core set of services to help prevent things like deconditioning, both from a physical standpoint and a cognitive standpoint and emotional standpoint, which tends to happen because sometimes care stops as people are waiting to transfer out of the hospital. So we have the co-designed intervention, and the impact of that work is that some of the learnings from the intervention was implemented in a set of leading practices for alternate level of care, which is available to all hospitals in Ontario. And also it brought patients and families together with similar lived experience, and they developed what I would call a bit of a support network, and realizing, oh, I'm not alone with this challenge, and there's other people who have either previously or currently experiencing this kind of episode of care that is stalled in the system. And so they developed a really strong relationship. We continued to meet throughout the pandemic. But what happened along the way, which is really interesting and a good learning, is we lost our connection to decision makers and sort of the receptor of the intervention. So we did all of this work to co-design, but at the end of the day, you need that constant engagement with decision makers, care providers, and system planners to implement the work that you've done. So now we're looking for that receptor to move forward with the intervention that we develop. So I say that's our biggest lesson learned, is to keep a good relationship with decision makers and providers throughout your co-design journey. And I'm out of time, so I'll leave it there. Thank you.
Thank you, Kerry. Monica Parry from the University of Toronto and David Wells, a patient partner, will now tell us about their project on building capacity for patient-oriented research in clinical trials.
We decided to describe our project by dealing with two questions. One is, what is the problem? And the second one is, what can we do about it? And I'll deal with the first question, and Monica will deal with the second one. So, as has been emphasized by many other speakers so far, research in Canada has not been focused on patient-identified priorities. So if we want to improve patient outcomes and have a quality healthcare system in Canada, we have to engage patients as active partners in health research. This means that patients must move from being passive receptors of services to that of proactive partners, shaping health research from inception, that is, from priority setting and grant applications, to dissemination and implementation. Patient engagement in research is influenced by three core values: developing best practices, improving research impact and quality, and building strong and successful collaborations. Recommendations for developing successful collaborations and capacity for patient-oriented research include positive researcher attitudes grounded in shared goals and strong communication practices, values of trust, respect, and co-learning, tools and resources for effective patient engagement, supportive policies, training for team members, and value for patient partners across all stages of research. Over the past 8 years, a plethora of patient-oriented research resources have been developed, but these need to be distilled, shared, and made accessible to end users. And we also need a way to ensure that patients are meaningfully involved in grant applications. All research team members, including patients and investigators, have patient-oriented research training, and that there are mechanisms to connect patients with investigators and research teams. I'll now hand it over to Monica.
Thanks, David. So what can we do? We need to lobby research funders for online patient-oriented research training modules with certificates of completion for all nominated principal applicants, principal investigators, and patient partners submitting patient-oriented research grant funding applications. Much like the sex and gender CIHR training modules designed to increase knowledge about integrating sex and gender variables in health research, our English and French patient and investigator decision aids are designed to increase knowledge about patient-oriented health research. They've been developed to distill, share, and make patient-oriented research knowledge accessible. They're written at a grade 5-6 reading level and will be evaluated to assess sex and gender differences in utilization and effectiveness. They've been rigorously developed using the International Patient Decision Aid Standards, a user-centered design, the Ottawa Decision Support Framework, and the Ottawa Model of Research Use. and patient partners have been engaged across all phases of development. Thank you.
Thank you, Monica and David. Our final presentation is by Lisa Hawke from the Center for Addiction and Mental Health, and Janice Lamb, a patient partner, who will tell us about the Wellness Quest project, a health literacy and self-advocacy tool developed by youth for youth mental health.
Thank you, Maureen. I'm happy to introduce the Youth Wellness Quest project to you today. We're a youth-engaged research team that focuses on youth mental health and substance use, where we work alongside young people with lived experience to conduct work that's relevant to them. A few years ago, now a group of youth came together to brainstorm on what young people need to support them in their mental health journey. And they identified health literacy as a major gap and a priority area to work on. They worked together then to develop a health literacy tool by reviewing literature and working together, sharing their lived experience about what is important to them. So this was a youth-led project where youth were the leads at every step of the research and knowledge translation process. And we, the researchers, were supporters, but not developers of the process. My colleague Janice, a youth on the project, is going to tell you more.
Thanks, Lisa. So hi, everyone. I actually got involved in this project in 2015, which is huge to think about. So it's really cool to see it come to full circle. So for this project, as Lisa said, youth worked together to conceptualize and develop a tool. Basically, this tool looks like a checklist and a guide, and this guide talks about what kinds of mental health services are available, what are their differences, and with a checklist, then youth can use this and bring it to their healthcare appointments, etc., to advocate for themselves, knowing what should I be asking, what should I be looking for, etc. So we developed this tool, and while there are these youth involved with developing it, and we all come with our own range of experiences, it was important, of course, to look elsewhere and see what do others think. So we actually ran an evaluation study led by youth researchers, and we had focus groups with youth coming in, and they discussed the design of the tool, the effectiveness of the information, etc. Now, something with this tool was that at this point, it was very much a print version. It was a paper version that youth could pick up and will be distributed to schools, resource centers, etc. Something that came out of that evaluation study, though, was that we wanted something online. This would make it more accessible for youth. That's when we applied for the Empower Awards with OSSU. Youth led that grant application process. And once we were awarded the funding, we worked with web developers to create this online version, which is now available for free. We had youth giving feedback with every stage, helping to make sure it was accessible, such as it was first created for the desktop. We made sure it was also accessible if you're on your phone. And since this product has been disseminated, there were 989 visits within that first 3 months. And now the next steps are to make a French version and to push it further into the Canadian mental health landscape. Thank you.
Thank you so much, Lisa and Janice. So what an incredible session. Special thank you to all the presenters for keeping this work that they've devoted themselves to down to a 3-minute presentation. It's a tall order. So if your curiosity has been piqued or you want further information about any of these projects, of course, you can always contact these people, but you can also go to the Empower Special Edition found on the OSSU website, where there's a complete article about each project. I just want to say personally, to see the diversity of topics and the innovative ways to expand the reach of these co-designs projects is so encouraging. I want you to think back to even 5 years ago. Had there been a session like this, it probably would have been presented entirely by researchers. So thank you to all of the patient partners who've also risen to the occasion and presented their work with such pride. It's great to see that. Congratulations to all. And don't forget to go to that special edition and tune in this afternoon at 12:45 for the second round of Empower presentations, which will be moderated by patient partner Annette McKinnon. And over to you, Dean.
Great. Thanks, Maureen. Thanks for moderating a great and wonderful session. And thanks to all the presenters. And as Maureen says, keeping to time, and 3 minutes isn't a lot, but they all did a fantastic job at keeping to that. And as Maureen said, there's even more information on our website, the OSSU website, as well as the Longwoods edition that presented a lot of the Empower Awards. I'd also like to thank, and on behalf of OSSU, John Lavis, as he provided a policy brief session to all of our Empower awardees, which helped them with their projects. And because we're ahead of time, we're going to take our first break a bit early. It's just turning 11 o'clock now. The next session will begin at 11:35 sharp, and that session is on it will be Diabetes Action Canada, one of Canada's 4 chronic disease networks. So until 11:35, we'll see you then. Bye-bye.